Well, if I told you there was a new procedure that improves self-esteem and quality of life for women, would you be interested? Well, it's there, and it's called the diVA. And here to explain all that it does, I'd like to welcome back Dr. Rakesh Nanda from the Grandview Aesthetics Center. Good to see you, Dr. Nanda.
Good seeing you again.
Okay, so first things first, what is the diVA? I just love the sound of it. I like the way it rolls off the tongue there.
It's actually a very catchy phrase. So the diVA is actually a vaginal resurfacing type of laser. So we're actually the first ones in the state of Ohio to have this laser, and one of a handful in the entire United States to have this laser. It treats a variety of conditions. So it treats incontinence, vaginal dryness, it does vaginal tightening, it helps with bladder dystrophy. So a lot of nice, really good procedures are done in a 3-minute time frame.
And you just mentioned, I mean, we just had Mother's Day not too long ago. We all love our moms, right? But after you have babies, things change.
Absolutely. So Mother's Day, we love Mother's Day. I had my mom up, you know, it's one of my favorite holidays. And there's a couple things that happen in a woman's life. There's childbirth and there's menopause. So those are two major things that happen in a woman's life that can cause some changes in a woman's body. Every woman kind of wants to get back to that pre-child kind of body, and we know that, and that's what Grandview Aesthetics Center does. But this is just another added bonus. We do hormones, but this is going to kind of help you get your women's parts back to the way they were before childbirth.
And you said too, a lot of women, you do have the option of hormone replacement therapy in some cases, but some women are hesitant to do that, and this would be a really good alternative.
Absolutely. So a lot of young women suffer from incontinence. A lot of older women suffer from incontinence. We have patients that are 23 that can get this done all the way up to 88. So incontinence is something that a lot of people suffer from. A lot of women jump on a trampoline and they have incontinence. They can't watch a movie without having some leakage. We can have really good improvements with incontinence. Also, dryness. You know, that happens with menopause. We see a lot of changes in the vaginal floor with menopause, and we're helping you get back to that state without meds.
All right, now on to the procedure itself then.
Yeah.
What are we looking at?
So it's a 3-minute procedure. It's very quick and easy. Discomfort is minimal. Most women will rate it as about a 1 to 2 out of 10, which is
wow. Yeah.
Most of them will say
which we've been through much worse, especially if you've had a baby.
Absolutely. A lot of them will say, hey, this is just like having an ultrasound done. That's basically what it is. You really don't even notice much. We'll just topically numb you up. There's no shots, there's no injections, there's no IVs. 3-minute procedure and you're out of there. You can do whatever you want after that.
And how about how many procedures? Is one enough? Do you have to go back sometimes?
So sometimes one is enough. It's actually it's a very specific thing. We like to tell women expect up to 3 treatments the first year, 1 month apart. So that's the expectation I like women to kind of have in their heads, although sometimes 1 or 2 procedures is efficient.
Okay, and you mentioned this is something where you can get it done and then go right back to your daily activities, right? So
absolutely.
Downtime recovery really non-existent with this, or what is the
yeah,
recovery?
So that's a great question. So basically you're going to be spotting for about 48 hours, just a little bit of spotting, and we don't want you to have any sexual intercourse for about 48 hours. Short of that, any other activity you want to do, you're good to go.
All right, and you said something earlier, the average age. There really isn't one, because you can go in your 20s, you can go in your 80s, right?
Absolutely. Any woman is a candidate for this. Any woman that suffers from any of the symptoms that this treats, which you mentioned earlier, is a candidate for this procedure. So it's amazing. And you know, we're able to save a lot of women all these surgical procedures that they're having to have down the road, daily meds. We're erasing that now.
What is the kind of the results that you're seeing? What are women saying after they get this done?
So we've done a bunch of people already, and you know, all of them collectively, I'd say about 95% have already noticed a great improvement in their incontinence. A lot of them are going off of their incontinence medications. They're saying they just feel better in the bedroom. Their partners are saying they can notice a difference. Women are happy because aesthetically things are kind of lifted up and back to the way they were before childbirth. So it's serving a multiple number of purposes at once.
So Dr. Nanda, whether it be the hormone replacement therapy or the diVA, your office is able to give them these options and offer all of it, right?
Absolutely. We've talked about hormone replacement therapy before, and that's a great option, but a lot of women may not want to do that. They may not want to take, you know, they might want to do pellet procedures, which we do. We don't do creams, we don't do shots, we do pellets, which is a great option because you do it once and you're good for 4 months, but a lot of women may not want to do this. This is a good supplement or a good alternative. So we have an option for everything now.
Perfect. All right, we do have the website. The phone number has been up on screen throughout, so thank you, Dr.
Thank you so much for having me again.